The question of funding in the fight against HIV/AIDS and how do we finance the response is a really critical one. And until just maybe the last 7, 8 years, there really wasn't a lot of funding going into combating this disease, and that has really changed. Now we can actually look across the world and really see that there's much more funding available. And when we look at the picture here to see who is able to provide financial resources to combat HIV around the world, there are a few key sources. They do differ from each other. The main source are donor governments. Governments like the United States, like countries in Europe, the G8 and other donor governments provide the bulk of the world's resources to combat HIV. And they do that in two ways. One of the ways that they do that is through their own bilateral programs, meaning a country like the U.S. will provide financial support for programs in other countries, directly to those other countries or those programs. That's called bilateral aid.
Government to government.
Government to government, or government to it doesn't have to be to another government. It could be government to government, government to a program in a country, but it's directly to that the next level is the country. And that's the bulk, that's a lot of the funding. Different donor governments focus on bilateral aid, some focus on other methods. The second method that donor governments use is multilateral contributions. In other words, giving money to another entity like the Global Fund, and I'll talk about that in a minute, or the World Bank, that it then distributes that funding for programs in country. Why would a donor do that? Well, some donors do that because the multilateral entity can reach countries that they can't reach. Maybe has programs in different countries. Some donors do that because they recognize that pooling resources with other governments in a multilateral organization can have other impacts. So there's reasons that donors do both bilateral and multilateral, and that mix will vary from country to country. So donor governments really provide the bulk of the world's resources through both mechanisms. Multilaterals are very, very important. So the main ones in HIV being the Global Fund to fight AIDS, tuberculosis, and malaria, and the World Bank. And there's some others as well, but those are really the two big ones. These are entities that are set up. Well, the Global Fund is set up as an independent financial instrument entity to raise finances from governments, from other donors around the world, and then in turn provide that funding to countries for AIDS programs and TB and malaria programs. So it's a very, very important source of funding. And it depends on donors, primarily donor governments, for its funding. The World Bank has programs throughout the developing world, and it also depends on donor governments for a lot of its funding, but it then in turn runs programs all over the world. So we have donor governments, multilateral agencies, and then we have the private sector. The private sector plays a really critical role here because the private sector, and by that I mean businesses, foundations, individuals, both provides resources, actual financial resources, as well as in-kind donations, whether it's medications, expertise, technical assistance.
And is the biggest player there the Gates Foundation?
The biggest player in the private sector is the Bill and Melinda Gates Foundation in terms of the amount that it's able to provide. Most foundations and most, frankly, any other entity in the private sector really isn't able to, they just have more resources. And I think it's even given that, what's really important to understand is, and the private sector is so critical, the bulk of the resources will always need to be coming from donor governments. And that's really where the amount of resources will be most likely to come from, whereas private sector can provide, could fill in the gaps, can do some innovation, can go places where governments maybe can't. But the private sector at this point in time will never really be the main financier of the response.
And in the U.S., the mechanism is PEPFAR. Can you walk us through that?
Sure. In the United States, the program that the U.S. government has created in 2003 is the President's Emergency Plan for AIDS Relief, PEPFAR. PEPFAR was a newly created largest U.S. health initiative and largest health initiative in the world, created to coordinate the entire U.S. government global response to HIV. Everything that the U.S. government is doing at whatever agency was then brought into this new construct called PEPFAR. It also included a dramatically increased amount of funding, and it centralized the U.S. response. And PEPFAR now the U.S. government's the largest donor of any donor, and PEPFAR is operating in over 100 countries around the world, providing financial resources, providing technical assistance, providing staff. The bulk of its resources are provided to what it calls focus countries, 15 focus countries.
Should reporters look to these organizations as sources of potential stories? There's an expression in the U.S., as you know, follow the money.
Right, right. That's the most important place to look for stories. I think following the money is the way toward your richest source of articles. And sometimes that is difficult. We should acknowledge for reporters that it is not always easy. I think people in the U.S. have had a hard time looking at trying to get some numbers out of the PEPFAR government. Even though they publish a lot of numbers, there's still a lot of nitty-gritty numbers they can't get to. But the Global Fund, for instance, publishes on its website, all the grants that it has. So there's an open source of information for that. Also, most of these organizations put out press releases very frequently about the funding that goes out. And once you have one number, you can then drill down deeper. You go and you ask, where exactly is this money going for what kinds of things? And you look back and compare it to previous years. So you can look at trend data, which is very, very important to try to judge whether programs are scaling up like they should be, for instance.
Sometimes you're surprised by who's benefiting. The money only gets, to within 10 feet of the ground. It doesn't actually get to the ground. But when it does, it's very moving. We told a story of a little, a little 4-year-old girl whose life was saved, and with PEPFAR funding in South Africa, a place where, as you know, the government still is reticent to acknowledge the role of ARVs in controlling AIDS symptoms. So, it's a gold mine.
Donors are all saying, well, we're going to really emphasize treatment. Well, then reporters should be saying, what's going to happen to prevention? If donors are saying, well, we can do a 1-year commitment, we're not sure about the next 3 years, reporters should be wondering what's going to happen. These are the financing of this response, given how enormous the epidemic is, given that the treatment needs are very high in terms of cost and are going to continue, that we haven't even as a global community scaled up our prevention response to the level it needs to be, that in addition to HIV, there's multiple other health problems out there that intersect with HIV or separate that also require resources. Resources are a critical factor. They're not the only factor in a response, but without them, we would really not be where we are.